Welcome to this short training video based on the HEE assessment strategy, which is available on the website. This video provides a brief introduction to the Supervised Learning Event tool, the case-based discussion, shortened to CBD. A CBD helps to determine the extent of a trainee's knowledge. It also assesses and encourages reflection on clinical decision-making. It gives the trainee opportunity to demonstrate their clinical reasoning and decision-making skills when undertaking contributions to care in practice. The supervisor should focus on the trainee's ability to demonstrate clinical reasoning and professionalism within the case they are presenting. The supervisor should probe the trainee on their ability to solve problems and the depth of their clinical knowledge, finishing the assessment with structured and systematic feedback. In the assessment strategy, the CBD is one of the assessment tools that can be used to record an assessment activity. Supervised learning events, such as the CBD, are a formative assessment which aims to provide trainees and supervisors with the appropriate information to facilitate and enhance further development. They will also support the provision of evidence that will contribute to the demonstration of the learning outcomes. A CBD can be based on a contribution to care carried out in a patient care setting, such as the dispensary, on a ward, in consultation rooms in the pharmacy, in general practice, in care homes, or in outpatient clinics. A case-based discussion is a retrospective evaluation of the trainee's patient care intervention. It should cover background understanding of the disease, awareness of treatment goals, evidence and explanations of interventions and management. Several different themes can be explored in a professional and structured discussion around a single patient case, such as pathophysiology, pharmacology, social pharmacy, therapeutics, pharmacokinetics, evidence-based medicine, ethical considerations, legal considerations, follow-up/monitoring, operation of local protocol and practice. The CBD form is divided into two parts. Table of criteria which provide guidance for the supervisor and trainee on the different knowledge, skills and behaviours that may be observed during the case-based discussion, and an area to document detail about the scenario, the developmental feedback and action plan discussed after the SLE and trainee reflection. The CBD has criterion prompts to assist supervisors during the discussion with their trainees. The trainee's ability to demonstrate all of the skills, knowledge and behaviours within a CBD depends on the individual stage of development within the training programme. For each criterion, the supervisor can choose to rate the trainee at below expectations, meets expectations, exceeds expectations, or not applicable. Meeting an expectation is based on professional experience and judgment, and so will be subjective to each supervisor. It is strongly recommended prior to undertaking any of the SLE tools that the supervisor sets out expectations within their trainees. For example, they may choose to set their expectation to the level of a day one registered pharmacist, or they may choose to set it at the experience of a trainee at the point in time of training. This will have an impact on the rating scale of the trainee, but should not impact on the action plan and developmental needs of a trainee. It is expected that in practice, some scenarios will not provide opportunities for all criterion to be met. Therefore, the not applicable option should be used and should not impact the overall assessment of the trainee. Trainees and their supervisors should use the developmental model of feedback, which is designed to encourage training reflection. This is covered in the Introduction to Supervised Learning Events video. Please refer to this video for further guidance. Once the feedback has been discussed and the trainee has confirmed that they clearly understand it, the trainee and the supervisor should form an action plan to capture future learning goals. This is covered in greater detail in the Introduction to Supervised Learning Events video. Please refer to this video for further guidance. This slide provides an overview of the CBD process and time required. Estimates of time will vary dependent on trainee/supervisor confidence in using the CBD, the sector of practice, and presenting scenarios. For further information on the SLE tools, please visit the HEE website. A more detailed e-learning module on pharmacy CBD is available on e-learning for health. The link to the training is available in HEE Trainee Pharmacist Foundation Year Assessment Strategy, available on the HEE website. For further information on the learning outcomes, please visit the HEE Trainee Pharmacist Foundation Year Assessment Guide and Strategy on the HEE website. This describes the assessment activities, which as a whole are designed to provide a range of evidence against each of the learning outcomes. There are also many other additional resources on the HEE website. For more information, particularly on the learning outcomes, please do look at the GPHC Foundation Training Manual on the GPHC website.